ahead and get started, and if people can join in and can chime in when they're ready. So welcome. You've made it to the forum on childcare and family care. Thanks for being here. I'm Jenna Koloski. I'm the Community and Policy Manager with the Vermont Council on Rural Development. So I'm going to be facilitating this session. I just want to start by saying that when the steering committee that came together, so some regional leaders in the area came together to select topics for discussion, I think they really intended childcare and family care to be in like the broadest sense possible. I think they were saying, you know, well, it's important to think about childcare, but also, you know, adult day services and caring for elderly family members and healthcare services and kind of the broad bucket of all that is caring for children and families. And so I'm going to leave this conversation pretty open to whatever direction it goes in. But what I'll do over the next hour and 15 is walk us through a series of questions. So we're going to open by hearing from one of our visiting team members, and I'll describe that more in a moment. But then we're going to discuss what do we want for our community in this arena? Like, what's our vision for what we want around childcare and family care? What's holding us back from achieving this? Barriers that may be in place today. We're going to discuss whether there are actually things, like I want a chance for you all to share what's going on in Windham County today. Are there things emerging that are exciting or promising practices or strategies in your region? And then we'll get into your ideas. What should be done? What should be done locally? What should be done? What do you need from the state to do what you're doing? So this isn't at all a forum where VCRD or the visiting team are coming to tell you what should be done in your region. It's all about hearing from you and hearing your input and needs and barriers and what help you might need at the state level. So that's the plan for the evening. I do want to mention we have Margot here from Windham Regional Commission. She's going to be capturing notes. So everything we talk about will be captured and shared back with you and shared broadly. We also have with us Trey Martin from Let's Grow Kids and Sheila Reed from Senator Sanders' office. Oh, good, Sheila. I couldn't find you and I was worried you dropped off. Sheila's internet has been in and out today, so we may see her in and out. And Sheila and Trey are going to have a chance to reflect on the conversation towards the end. And Margot, you would be welcome to share some reflections and potential resources at the end as well. But first, when we put these forums together, you know, one of the charges from the governor when he set up this action team and asked Paul to lead the team, one of his charges was collecting and sharing strategies and practices around the state. And so it was important to us to kind of in each forum have somebody to open the session and to frame the conversation, and either other local examples or someone with statewide perspective that could kind of share, you know, what's going on in this arena today. This is a broad topic, but we're going to narrow in on the childcare side of it for this opening session, and then we'll open it up. But we have Trey Martin with us from Let's Grow Kids and have asked him to share a few minutes to open and frame the conversation. So thanks, Trey.
Well, thanks, Jenna, very much. It's a real privilege to get to talk to everybody tonight, and especially on such a nice night, at least here in central Vermont. I'm in Montpelier, in the only person who uses this office, so I was able to come in today, and I'll clean it up when I leave, wipe all the surfaces down, all that kind of thing. I know there's a lot of expertise with that on this call. I was going to say in this room, as I look around and see people who are working on this every day, and so I really appreciate everything everybody's doing. And I really, I mean, to Jenna's point earlier about whether it's better to have a statewide perspective or hear from somebody local, there's a lot of expertise looking around the checkerboard of faces. So hopefully we'll do a lot of listening tonight and hear a lot of good ideas. To get to Jenna's point, I am going to talk mostly about within childcare, family care, and family needs, the work that Let's Grow Kids does and focuses on the 0 to 5 system. But a lot of what I'm going to talk about is applicable within the school setting, and it's applicable within the whole concept of cradle to career education, whether that's aftercare, vocational training, adult re-education. There are a lot of the lessons that I think that we've been developing and seeing are true for, across those different sectors. And I hope that we will get into the analogs and parallels as we go through this. I wanted to just show a picture, if I could, Jenna, with my share screen. Does that work if I grab that? I won't do it for very long. I just wanted to, does everybody see the bell of success there? Just give me a thumbs up. All right, I'm going to take that back off so that this isn't a slideshow or a picture show. But I'm from Let's Grow Kids, so of course I'm going to talk about kids. I'm going to start with my own 10-year-old Tegan. It wasn't that long ago that he and I went to Danville. This was last August, early September, and went through the 28-acre corn maze there. There are a couple of things I think are amazing about the fact that that was only 10 months ago. One is that nobody's going to be walking through corn mazes together this year. Two is that the kind of culture that we created in there, that spontaneous culture where people get together and are able to work together, has changed fundamentally, right? So we are able to come together in forums like this and in small group settings with people that we trust. But the idea that you'd be able to go into a maze, get totally and flabbergastedly lost for about 2.5 hours, walk something like 8 or 10 miles, and come to know and depend on a whole group of people who you met for the first time, who you'll never see again, high-fiving them, seeing them over and over, passing within 6 feet of them, nobody masked, nobody, stopping to ever think that they wouldn't talk to these new strangers and friends that they've met. That's something that's, maybe not irrevocably lost, but seems like it's terribly displaced in our lives. And of course, the idea of getting through a maze is something that is really important to us too, because we do look at the issues facing the education system, childcare, the complex regulations, the complex funding needs that we have, the complex needs we have for capacity, even in Windham County, where you all are doing a really good job providing high quality care. The number of available seats for infants and toddlers is not where I'm sure you would want it to be. And even though there are a lot of seats for 3 and 4 year olds, there's certainly not as many as are needed, at least at the last time we looked. So we've got a lot of work to do here. And it sometimes feels like we're never going to get to the bell of success, which is why I put that up there. I wish it was just as easy as walking through a maze and talking to some strangers and getting there. Paul did a good job at the outset of kind of saying the context we're in nationally. I mean, it's a real mess out there. It's scary to think about what's happening in some states as they've reopened and the behaviors that we're seeing from certain people. We've got an historic election coming up. We've got racial turmoil without a lot of restorative justice leadership happening. We've got swimming pools closed almost everywhere in the country. For a while, there wasn't going to be a professional baseball season for the first time in 152 years. It's like a Margaret Atwood novel out there. It's terrifying. And Vermont's done a fantastic job on the health side, right? I mean, Dr. Levine is being asked to come speak at the national level. We have established safe communities. We've established really good protocols. People are doing the things they need to do, including providing childcare for essential workers and making sure that doctors and nurses and folks like that have people who can take care of them. Almost, I'm not going to say without any fault or without any, liability or risk, because in Windham you've had a couple of cases, and while they didn't spread, I know that those things are being paid attention to. But we did stand that up, and we are slowly reopening, and it does seem like we're getting into vacation season without seeing a lot of pop-up of new cases. So we're doing a great job. But the hospitality sector is really hurting. The restaurants are really hurting. Other small businesses that depend on face-to-face traffic are really hurting. Schools are really struggling to know how to message to parents who are concerned about risk, and at the same time, invite kids back who need to be in schools. Same thing with childcares. But as a sort of a community organization, our schools are in deep trouble. And we are, looking at a lot of the state contracting that used to happen is going to be interrupted. So we're seeing some pretty big disruptions. There has also been great leadership. Paul, we can't thank VCRD enough, but leaders like Jenna and Paul, who bring people together to search for solutions. Even in this kind of a forum, you have to do it on a Thursday night, over dinner time, and come together, virtually. We are starting to pull together, and it's pretty exciting to see that happen, because proactive planning and solution, finding is what communities at their best do best. Identify common problems and then come together to identify the solutions that might work, and then hone those down carefully over time to figure out what's the first priority, second priority, third priority. So in the childcare world, right, we had an initial slate of closures. We reopened for essential businesses. There was a lot of new health and safety regulations for those. And then as we started to reopen after June 1st, there was even more new safety regulation. There was a sort of swath of state dollars that were invested, $6 million for the stabilization program, another 12, millions expected to come in a restart grant program that's going to double what was already spent there. And like I said earlier, we're slowly reopening without having a lot of negative impacts, without having spread or community-based spread of the disease. What we don't know, we think that about 70% of the programs statewide are open, serving about 50% of the kids. But we really don't have sort of on real-time live data of what's happening out there. In Windham, even before COVID, as I said, 3 out of 4 children under 2 didn't have access to a high-quality spot, and about half of the preschoolers didn't have access. So what we're going to find as CDD, the Child Development Division of Agency of Human Services, conducts its kind of analysis and survey work this summer, we don't know. But we expect that there are going to be people who don't come back to care and people who need care in a different way than they did before. We're going to see businesses that used to be open that were very successful models that can't stay open the way that they did. And we're going to see childcare businesses that weren't flourishing before, but somehow have figured out, whether it's through outdoor play or some other, kind of change in setting, that flourish in a way that wasn't there before. But whatever it is, everything is reshifting and resettling. And that feels chaotic. It feels like you've taken the water with a little bit of mud at the bottom and shaken it up so it's now all filled with mud and you can't see through it. And so as that settles down, we'll be able to see through it, and it'll be a little bit more clear. And we're going to get that data from CDD. We're going to understand from communities what is happening in terms of employee needs. We're going to know what's happening in schools and aftercare and vacation care coming up this year. And big employers who aren't open now but are trying to reopen over the next few months will come to decision points about whether they can do that. I'm thinking about some of the bigger institutions, like higher education, which is, you think of what's happening at Landmark College, what's happening at Vermont Law School, what's happening at places, even Vermont Academy at the high school level. Are people going to be able to come from all over the world and all over the country to those places and open back up, and what's going to happen to those jobs? So I guess what I'm saying is that we have a lot of questions to answer, but if we don't start identifying what those questions are and we don't start figuring out what to do with some of the answers when we get there, it's going to be hard to move forward and take the next steps. So again, just sort of returning to the theme at the beginning, we're a little bit lost in the maze right now, and we can't give each other a high five as we wander through, but we can come together at events like this, and we can talk about what we do know, what's happening locally, what's happening with the employer down the road, what's happening with the empty building there that could be a sort of outdoor-based space for taking care of kids or schools. And I think that we can lay some really good groundwork here tonight by talking and listening to each other about sort of what those needs are going to be, so that as that pattern emerges, we can highlight the first priority and the second priority and so on. So anyways, thanks very much to Jenna and VCRD for letting me say a few words. I love talking about Teagan, and I loved the corn maze. It was obviously a singular event in my year last year. All wander together and meet at the end at that bell.
Thanks, Trey. Appreciate it. And that image really resonates with me right now, that feeling of being in a maze and working to figure it all out. I'm sure some of you feel the same way. So let's dig in a little bit on the conversation, and then we'll hear from Trey again at the end, and Sheila too. So the way that I would love for you all to participate, a couple of different ways. You can either, if you click on participants, there's a little button that says raise hand. So you can raise your hand, and then I can see that you'd like to say something, or I'm happy to just have you unmute yourself and kind of say, hey, and shout, or if you have your camera on, you can wave at me, whatever works for you. So the first question, I would love to hear from folks, to hear, like, when you think of, and I also want to say, when you speak, if you could just introduce yourself. We don't have time to go around the whole room, but if you introduce yourself and any affiliation you want to mention or not is fine. So when you think about childcare and family care in the Windham region, what would you like to see? Like, what do you want for your region and your community? What would if everything was working well, what would it look like for you? What would your vision be? Is it Ola? Is that how you say your name?
Very close. It is Alla.
Ola. Okay, thank you. Go ahead, Ola.
Thank you. I work for the state in the Economic Services Division as the Reach Up Supervisor. So we're working with families, helping them find their way to economic self-sufficiency, which often, but not always, means employment. And for our families, that means reliable childcare. And at this point, many of our families who have not yet been able to reconnect with childcare are expressing concern that should they send their children to childcare and return to work.
Well, Ola, before, it sounds like you're kind of about to go to a challenge, but I want to stay with that vision idea, but if you hold on to that, that's where we're going to go next.
Okay, the vision is reliable childcare.
We got it, yes.
Thank you.
Thank you. Other vision points? I know it's hard not to go to challenges right away, but let's stick with vision for a second. Meg, go ahead.
Well, I mean, we really share the same thing. We really have a lack of childcare in the best of times, and this is the worst of times, and there's absolutely no options available really in our region right now. And so we're facing a huge challenge. So our vision is we have spaces where there could be childcare provided, and we haven't been able to provide providers. So our vision is just having childcare, ideally just having availability. We have nothing. So people are really in a tight place here right now. So our vision is having safe, affordable, available, having teachers who are willing to work in the spaces that we have available. So making that matchmaking, I guess, is our vision, is to find those people who are willing to say yes and to move into space that we do have available. And we just need support to help make that work financially and with the new regulations. So I guess.
And when you say we, Meg, do you mean Wilmington Works, or is
I mean Wilmington in general, like
Wilmington
our region?
in general.
So, yeah, Wilmington in general, our region. I mean, I fortunately don't have children that need childcare anymore, but it's been a challenge for years and years in our region, even having any availability. And now there's absolutely nothing. And so people who want to return to work aren't able to. And so we're hoping that sort of out of this crisis might come the ability to make those connections for people who want to work in childcare. And we have locations where we could have childcare, and our vision is that maybe we can make it a reality and make those connections and make it happen and get some funding.
Great, thanks, Meg. Ruby, go ahead, and then Amy.
My name is Ruby McAdoo, and I'm from Putney, Vermont, and I'm a volunteer with Putney Mutual Aid. And so I'm here in that capacity kind of to, because we're at the beginning of a brainstorming process where we're trying to think about how can we as a volunteer mutual aid support network make some of those connections that the participant from Wilmington just talked about. How can we find someone who was an educator and is retired, but is in a safe enough environment that they feel like the risk factor isn't too high for them, and they could watch a kid or teach them science for, 2 afternoons a week. And this is particularly important because in our school district, we are starting our school year in a hybrid model. So we know that if you are doing in school, you have 3 days that your kids are not in school, and therefore you need something.
What are you going to do on those days? Worker. Yeah. Absolutely.
So I think that from my perspective, they're in an ideal world, we have, in addition to supporting the childcare institutions that some of them are shuttering, some of them need support, finding a way to bolster them and allow for spaces where people could, come out of the woodwork and start anew, but also find some creative ways to fill the gaps. So people who aren't looking for full-time care and might not even be looking at it for long-term, they really just need, a day or 2 days or 3 hours. That's the piece that from a mutual aid perspective, we're trying to think about how can we fill that need. And then the only other thing that I think in an ideal world, access to information is so key. And what the gentleman who from Let's Grow Kids talked about, where you have some water with some sand on the bottom and water, and it just got shook up and it's mucked up. That is how we all feel. That's totally it. And so I would love we have Winston Prouty in this area, and we're very lucky to, an organization like that, or an organization somewhere, within the state as a whole, collecting that information as the changes are coming, so that people know how to connect to, and it's not just that you happen to have your finger on the pulse. If you're a working parent and you're like, oh my God, what am I going to do? You might not know to show up here to get information. You might not even know to go to the website. So the shared information and making sure that it's really out there in a good way is key.
I love that. And Ruby, it feels like I've got some good vision points there, but also some little seeds of ideas that we could dive into as well. So I made a couple notes to come back to when we get to ideas too, because it feels like it'd be good starting points for conversation. Amy, you have your hand up?
Yes, I did. So I'm Amy Howlett from Rockingham Mutual Aid, and how great that I'm following right on the tail of Putney. All the issues that you brought up so far, my vision is that we give parents the availability of enough options so that there's always a plan B. I mean, I remember this from childcare. You had everything set up, and you had your key person, and then somebody'd get sick, and you had to have a plan B. We're worrying about families. It's exactly what Ruby said, who need 3 hours of respite. They've been okay, but then something falls apart, and they just need a new piece for a week or a day. So everything that's already been said, but an awareness of a number of options. And with that, of course, different funding levels. And of course, the whole spectrum, birth through, 7th graders.
Yeah, thanks, Amy. And I'm seeing a lot of agreement in the chat too around affordable, accessible options. Absolutely. As a mom of an almost 2-year-old with our daycare still closed, I am feeling all those in a big way right now. Other thoughts on this? I also want to, I'm getting the sense we're going to be mostly focusing on childcare in this conversation, but certainly other aspects of that family care would be welcome. Dana? Oh, you're on mute, Dana. Dana, you'll have to unmute yourself for us to hear you.
Good. I'm only 73, so I'm just learning this. Okay?
We're all learning. We're learning right along with you.
Brand new, I'm glad. Hello, Emily. I am recently in New York, in Vermont, from New Jersey, but I've spent my life in early childhood. And I can't tell you how grateful I am to be in Vermont, and particularly in our area. I represent CC4G, which is trying to develop an infant, waddler, toddler, going into 3s to 4s to get them into preschool in the Guilford, Brattleboro area.
What's the group you said? CC?
It's the, I'm sorry, I'm not good at this.
No, you're doing great.
Community Collaborative for Guilford. It's a nonprofit organization that is trying very hard to find a space in Guilford for an early childhood education program. The community, the select board, we're all there on board. And we have been able to work with the Omega Corporation, and we are developing a program to develop that, but funding, of course, is going to be the key. What I'm hearing is that we need to really reach out, and particularly when we're looking for some part-time care, 2 to 3 to 5 hours a day. And I'm wondering about some of these programs that are federally available to train seniors and pay for them to be able to work in early childhood for 20 hours a week, with the hope that they will then become sustained workers in the community. However, that's a beginning point. My idea, and from my background coming out of New Jersey, thank heavens, I'm now in Vermont, is that we really need to begin to develop the government, the public, the philanthropy, and the local families to develop a sense of community for their very youngest children. I really, truly believe and know, because of what my experience has been many, many years ago, that there are ways that we can use federal dollars to be matched to local dollars that can be matched into the towns that can begin to raise the money to develop the infrastructure that we need in order to develop spaces for children, as well as the ongoing cost for children. And I'm thinking, I'm still not very familiar with how Vermont works, but I am familiar with some of the monies for community block grants that are going to become forward. I was able to use that money to build a child care center in Union City, New Jersey, which is right on the cusp of New York. And we were able to serve a number of children and families where the government officials had never thought, or the local officials had never thought of using local match grants into the federal dollars that came out.
So Dana, I feel like we're getting a little bit into details around ideas, which I love.
Great.
And I would actually love to, like,
Later on.
I'd love to bring you up to Huntington to do some of this work up here. But what I love is the vision point you mentioned, which is developing a sense of community for our youngest children.
Yes.
And I think that really captures a lot of these other ideas that folks have brought up as well. So I do want to take a little bit of time to get into challenges. We all know there are challenges. That's partly why we're here, to discuss those challenges. So what are the barriers holding us back from achieving these vision points that we mentioned, these connections we want to make, supporting these institutions, reliable child and family care for families in the state? What are the barriers in the Windham region?
Money.
I was going to say, it seems like that's probably the primary one.
Infrastructure. It's not so much about maintaining a program once it gets going, but it's about being able to develop the licensable space.
Ola? You'll have to unmute. There you go.
I'm learning too. I'll throw out a challenge for everybody. We've lost most of our non-center-based childcare with the changes in regulations and training requirements. We need to move the box. We need to get rid of the box. We need to help community find a way to help community in a quality way. And so that's back to challenges, but that's one of the barriers, is that we have put ourselves in such a small box with the qualifications that are required to provide the service.
Yeah.
We've got another box that is how the subsidies fund it. So if you've got a subsidy, you are locked into only certain hours or certain numbers of hours, and you're stuck. And if you're going to work and you can't drop your child off before 8 a.m., but work is at 7:30, and you have to pick your child up at 3, but you don't get out of work until 3, 20 miles away, you have now no job.
Yeah.
Thank you. And I'm seeing in the chat, Cindy's saying it's in Wilmington, it's personnel. They have issues. They have space, but can't find people to fill it. Sue Fortier.
Hello, hi.
Hi.
Much of what I was going to say has been said. I think licensing is definitely an issue. Staffing, because of those licensing requirements. And the other thing is, and this kind of goes to my vision, is really about more collaborative efforts that allow, and that the thinking involves not just me, myself, and I, but everybody that's potentially a partner, willing, to work with you. So as we consider school age childcare, sorry, I'm from the Meeting Waters YMCA. I did not say that.
Oh, thank you.
And we are currently running camp and busing kids from all over Windham County up to our day camp. But as we start to consider school age care, we have to have the school system as our partner in order to do that. And I think that that's true for a lot of us as we're looking ahead to how we serve families in this new model of life.
Yeah, thank you. Other challenges anyone wants to share? There's a lot of folks that, maybe that have video off that haven't had a chance, and feel free to chime in even if you don't have your video going. Everyone's welcome to share. Ruby, go ahead.
I guess I kind of wanted to jump off of what Sue raised in Putney. I think that it's crucial that we not only have the school as a partner. I think area organizations in Putney Community Cares, traditionally as Putney Family Services, kind of came out of a need for childcare. Putney Mutual Aid could be a collaborative organization. But I feel a little bit that the challenge I'm seeing is that, particularly with the school system, I just came off of a call with the superintendent who's new, and there's all these different changes and things that are coming up and new information, but it feels really siloed. It feels like they're making decisions and they may be thinking about childcare, but I don't know that, and it could be that the right partners are at the table and I'm just not one of them. But as a key organizer for a volunteer organization in town where we match people who have needs to volunteers, it feels really siloed. And I don't say that, I actually think our school district is doing a pretty good job considering and have a lot of compassion, but I also think that that's a challenge that we need to face that, acknowledge it, and actually overcome that challenge in order to have a real success.
Yeah, thanks, Ruby. Meg.
Hi, my name is Meg Gonzalez. I am the director of West River Valley Thrives. We are a prevention coalition, and we work closely with Cindy Hayford. Our area is the Windham Central Supervisory Union, and so we don't deal directly with families with young kids, childcare needs, and that kind of thing necessarily, but we are concerned about healthy families in general. And I think that some of the biggest challenges that we're facing right now, especially with the online learning, as most of you know, is that it's really creating this bigger crevice between the haves and have-nots. And we're really concerned about those families that don't have reliable internet, that don't have the devices. A lot of the resources that are coming out for families now to give their kids things to do and to help with the education and all of that is all online. So we're really concerned about those families that are not able to really take advantage of those resources, and how do we make sure that they get the help that they need. And, you know, when school is in session, for our school district, Townsend and Leland and Gray Middle and High School is the hub. So one of the big challenges that I saw when I took this job at the beginning of the year is the fact that these rural communities don't have family centers or any place that we could decentralize and start to provide services closer to where the families live. So just like Dana was talking about, these funding that you get, the community block grants or things like that would help with infrastructure, that we could provide services closer to where these families are. I mean, we're 350 square miles, so if the families aren't coming to Townsend, they aren't getting the help and the support that they need. So I think that a big challenge is finding ways that we can start to decentralize some of the service areas and some of the services and get them out to the communities closer to where these families, especially the ones that are struggling with access and resources.
Yeah, thanks so much, Meg. I appreciate that that concern. And it's interesting, this is our third county forum now, and I did facilitate a similar one in Orange County on Tuesday night, and that was, Meg, a theme that was just really prevalent throughout, that of equity, and how, you know, as we try to help our families get through this time, are people able to access services in the same way, and what alternatives benefit some and not others. And anyway, that's an important theme to consider, both in challenges and as we think about ideas. So I'm curious to know, does anyone have things they want to share that are going on today in the region? Dana, it sounds like there's some great work going on in Guilford. Other emerging practices you're seeing, or what's going on today in this area? What's working well already? Go ahead, Dana.
It seems to me that since March, our world not only has changed, but we all, as early childhood educators, know what we need to do to go forward to take care of our communities and our very young families and our very young children. We really, truly need to push forward to get the legislatures, many of the business people they just don't know how important it is for them to support their employees for early childhood education. So it seems to me that we really must develop a partnership between government and the local communities and the families. Hopefully, in my opinion, I may be going out on a limb now, but in my opinion, as we go forward to November, it seems as if there are some particular emphasis on early childhood that I've never heard of in my 50 years of being an early childhood advocate. And we probably need to really go forward and push with our legislatures and begin to really talk to our local community people about how would you feel about supporting an early childhood program in your community for your employees.
Great, thanks, Dana. So one thing that is happening today, you're saying, is that there seems to be some new energy and maybe recognition of how important that sector is, and how we need to boost that.
If Vermont is going to bring in young people, that is it.
Yes. Yeah. Thank you.
Along with being able to have good internet, please.
Yeah, let's add that to the list of challenges too, right?
Yes.
Ruby, you have a hand up, and then I see Amy and Dora.
So again, I work with Putney Mutual Aid, and the thing that's happening right now is we're putting together, we're trying to envision a few different levels of proposals of how community members could participate in helping other community members care for their children. And I think that we have, you know, from the level of really a volunteer thing that would require whatever types of waivers you need to sign and all that, to something that has a structure where you might be able to hire someone. Those we're putting those together to kind of pitch those and propose them to Putney Community Cares, and if they don't bite, try for someone, because we as Putney Mutual Aid we're not an organization. We're a group of individuals who are coming together to try to help our community, but we don't have a structure, and we want to do this in a way that is sustainable and safe for everybody who's involved. And so I think that I would say that's something that's happening right now, but it also has some challenges in it because, you know, we've spoken to Chloe at Winston Prouty, we've spoken to Dora at Building Brighter Futures, and the resources are there and they're very helpful. So I think just continuing to do those kinds of connections to make sure as we move forward, we have the resources that we need to make it a success.
Thanks, Ruby. I love that. You know, we've been convening mutual aid groups pretty regularly, and a lot of groups are trying to think about what's next for them and what to take on next, and that feels like a really excellent way to support the community during this time. I jotted it down as a topic for a future call for mutual aid organizers. Amy, you were next, and then Dora.
So I think that the mutual aid that's happening in Rockingham is doing some great things so far. We're collaborating well on food delivery. We did a great survey and needs assessment, but you're making me think, everybody who's contributing to this discussion, that we've really been missing out on the early childhood education piece. Our area child center is in Springfield, SAPC. So that feels a little bit far away. We have been working with Ellen Tetch in Building Bright Futures and working towards respite for families through babysitting. But I don't think we're as advanced and thoughtful in the areas that you've come up with. And I'm also thinking that most of the volunteers who are meeting routinely are seniors. So maybe we haven't focused on that. I should say that the public library is very involved, and they certainly have that concern about families and what's going to happen with them. But I have the feeling that we're a few steps behind the rest of the speakers who are here.
Thanks, Amy. Well, we're all learning as we go, for sure, and maybe there's an opportunity to connect and work together on that. Dora, go ahead.
I'm Dora Levinson. I work with Building Bright Futures. I'm the regional coordinator for Southeast Vermont, so most of Windham, and then I'm also the policy analyst. And just a bright spot, I think, is there's a group of directors that has been meeting, and the Vermont Early Childhood Network is really strong here. So the directors have been meeting regularly and really troubleshooting so many of the challenges with new regulations and questioning interpretations and sharing information about talking with a licensor. All of these types of things that it's so hard to navigate. And so if there's a little bit more, if there's a sounding board, it can be really helpful. And I've been able to participate in some of those conversations and both elevate concerns as well as share some information that people who don't sit in meetings all day might not know about. But, you know, I think that it really is, there's so much wisdom that is in the programs that exist, that that using that is really important, making sure that on the ground perspective is considered, you know, when making these regulations, and continuing to be able to use these real these networks to support the programs that exist to continue serving children.
That's great. Thanks, Dora. And just a quick question. You said the Vermont Early Childhood Oh, okay. I had to see it written down. You mean the directors in that region are really strong and they're convening regularly. That's not a
right. So it's like the formerly Starting Points Network.
Okay.
Yep.
Got it. Thank you.
And the subset. Yep.
And I'll just point to the chat. Mariah is saying, and probably a lot of people agree, that early childhood educators need to be paid more, but it can't fall on the families to do that. And Chloe is saying that we need public investment in the infrastructure and a systems approach, one with flexibility. Absolutely. Dana, I'm going to go to Margaret first, and then I'll come back to you. Go ahead, Margaret.
Hi, I'm Margaret Atkinson. I am the Director of Development and Community Relations at the Winston Prouty Center, and I'm also the Chair of the Windham Region Hunger Council. So I have some experience in some of the great mutual aid work that's been going on in the community, especially around food and partnering with schools to make sure that families are getting the food that they need during this, especially during the shutdown time. Since folks are here from the state, I think that, you know, it's important to say that one of the things about this crisis that has been a plus for the whole concept of childcare is that people are now really understanding how it's a vital part of the infrastructure people need to go to work. Mm-hmm. It is a public good, just like roads and internets and banking laws and all those things, and that there's an opportunity during this time of disruption to really look at what the value of that is for not just families with young children, but for everybody in the economy. And so I think the state did a really pretty good job in supporting the businesses during the shutdown. And you know, they've tried hard to have resources be available, but this was an underfunded and, you know, difficult business model before COVID-19. The cost of providing services to families are more than what families can afford to pay. And even with subsidy and support from other funding streams, it's a bad balance sheet for most of these businesses. So, you know, there needs to be a real larger system talk in the state about what is this infrastructure worth to get, you know, to have a thriving economy. That's one. And then the second thing was just there are quite a few programs, of course, around the region that are open and, you know, at various levels of capacity and doing well. And I think that, as mentioned before with the co-op and the directors groups, there's a lot of wisdom and I think a lot of learning that schools and other organizations that will be working children as, you know, in the coming months could really learn from. And it would be great to see some collaboration and some exchanging of ideas and experiences. Because, you know, some of these, you know, Winston Prouty is quite a large program, and we have now been caring for children for, you know, 2 months now. And I think folks have learned a lot about how to make that happen in a way that works for the staff and the organization, but also for families.
Yeah. Thanks so much, Margaret. Appreciate that. Dana, you were going to say something.
Well, thank you for Winston Prouty. That's all I can say as I come into the community. This is an issue of quality of life at this point for our country. And we have an opportunity, I believe, to begin to say to everyone involved, we need to provide early care if we're going to survive in an economically developmental manner in this state. We need to provide early childhood. I come out of New Jersey. Thank God I'm here in Vermont. However, I have had many of my friends have said, so what's around your area? Because I don't want to live in New Jersey and right near the border of New York and New York. We can do this if we have good internet. We have an opportunity here for real economic development, but we're going to have to really push forward to say part of that has to be that we provide early care for our youngest families to come in and be a part of our community and be able to settle their families here. It's a real opportunity for us, and I know many of our people, our legislators, at least in Windham County, are on board with this, and those that aren't, I think we need to pick on them.
Well, so I think, Dana, I think you're right on, and I'm getting the sense both when Margaret was speaking and when you were, people are nodding their heads, and I think everyone is on board. And I guess first maybe I'll ask, are there any other Any other things going on in the region that folks want to share, people that haven't chimed in yet, that want to make sure we capture in the notes what's going on today? Chloe?
Sure, I'll just, can you hear me okay?
Mm-hmm, yep.
One of the thoughts going through my head is how important collective impact is right now more than ever, sort of cross-sector groups to tackle our most challenging issues. And Building Bright Futures does that. The Hunger Councils are a great model. One of our local ones that we're trying to sort of harness energy from multiple sectors is the Child Care Counts Coalition. We, have representatives from early childhood, but also BDCC, the hospital, higher education, the career center. So trying to pull all the threads together. For instance, I think that where there's a looming issue, many people talked about around schools are not going to be every day. So it's not just 0 to 5 that we need to worry about. We have to have fall camp and winter camp and all of those things. So how do we bring together the right people to have a community conversation for problem solving? And I'm hoping that coalition can be helpful.
You said that was the Child Care what coalition?
Child Care Counts.
Counts.
Yep.
And that's like a county-wide group?
Yep. It's been pretty small. We've been around a couple years, 2.5 years. We did a survey a couple years ago, building on Windham Child Care survey. We helped get the early childhood career pathways started again at the Career Center. Yay. So just trying to tackle one thing at a time and raise the profile of early childhood education. So hopefully we can be part of a community conversation about this the next challenge we have and opportunity. It's a vision and a challenge, and all of those things is how can we creatively address families' needs? Because it's gonna, even if we created fall camps and winter camps for those 3 days that kids are not in school, who's gonna pay for it? Families can't suddenly pay for it. Will subsidy pay for it? I echo Margaret's sentiment. It was great that the state stepped up and really offered some support, and we have to find ways to make it sustainable and keep it going. So.
Yeah, thanks so much, Chloe. So I want to move on to thinking about ideas. So you just posed some really great questions, like how are we going to build those coalitions, create collaboration, build partnerships? How are we going to support families? And we're not going to answer all those questions tonight, probably, but I do want to try and think about, are there things that could be done at the local level, regional level, or even what might be needed at the state level? So I want the next 15 minutes or so to serve as, number one, an opportunity to share your ideas and maybe, connect ideas that are already emerging, or just get them out there and get them on paper. But also remember that the governor's action team is collecting these ideas, using them to share to other parts of the state, using them to share up to the governor on recovery efforts. So this is a chance to also, get your ideas and thoughts in front of those folks as well. So Ruby's jumping right in there with an idea. Go ahead, Ruby.
So in Putney, I was not part of this when it used to exist, but we had an interagency kind of council where the food shelf here, Putney Community Cares, the library, all would come together and share information. And this is pre-COVID-19 crisis. That kind of fizzled out for a variety of reasons, and those organizations have been active in different ways, but we're trying to revitalize that interagency coalition kind of, and Putney Mutual Aid is part of that resurgence. And the hope is that we don't know what will come, out of collaborations from that, but certainly the sharing of information and knowing what's going through the kind of brains of each of the people who are kind of key in those organizations is what we're hoping to come out of that.
That's great, Ruby. So it's kind of a, like a coalition, but at the hyper local level. It's these community organizations working to improve Putney and support Putney residents. I love that idea. Other ideas that folks want to share? Dana raised her hand and then hesitated.
Of course I did. Why can't we add a 1% tax for early childhood education into our tax bill?
And when you say they, you mean at the state level?
At the state level. I think the feds, it depends on what happens in November, but I think the feds are beginning to truly understand that early childhood education is an essential service. But why can't we do that here in Vermont?
Yeah, why not?
Why not?
Thanks, Dana.
A start.
Olive?
On the shorter term, I had to step away for a couple minutes. So I'm not sure if anybody brought out the amount of fear on the parts of many, many parents on having their children go to school or go to childcare, that the children will be sick or bring it home. And they're fearful that the children will not be able to deal with mask wearing, which I've seen an awful lot of kids wearing masks in the store without issue. We need small events. You know, when I say small, limited numbers of people with parents and children all going, and they're having a good time, and they're all wearing their masks, and it's practice for starting to get back into the world safely.
Interesting. So yeah, starting to do some education and support with families around, like, here's what it would look like to be re-entering the world, having our masks on, interacting safely.
Yeah,
interesting.
The schools could do that to help the kids prepare, although I'm afraid listening to our parents, a lot of them will not let them go.
Yeah, it certainly are mixed opinions on that. What about that idea of, well, maybe I'll shift it a little bit. There's supporting families, and then also, like, what about supporting teachers and early educators and providers? I mean, are there ideas on what could be done or what might be needed in that way to support our caregivers and providers? What, 1 second, Dana. Let me see if other people are ready to dive in.
I'm sorry.
No, no, as a facilitator, I like when people are ready to jump in, but I want to make sure other people have a chance. Thoughts on that and what might be needed to support our providers as they enter into this new world, or maybe are already there? Does it feel like caregivers or early educators' needs are being met?
No.
I'm seeing people shaking their heads. Chloe?
I mean, I would say in the same way that the pandemic has amplified issues that were already a problem. Rate of pay is horrendous. You know, I was talking to somebody today, like, my teachers are on the front lines. They are not getting paid frontline pay. Right. So I think their emotional support, we certainly talk about training, professional development, emotional support. We're talking about all of that. And money is not everything, but in this case, we need to pay everybody $15 an hour minimum, no matter whether they have a degree or not. I'm sorry, it's just needed. And so one of the things the state did that was great was the Restart grants. They were not, there weren't a ton of strings tied to it, and they're, but again, it's a one-time pot of money. But if there are ways to create sustainable funding so we can sort of keep supporting people on the front lines, that would be a good thing.
Great, thank you. Sustained funding.
We need to support our teachers who have children, because how are our teachers going to go back to work if their children aren't in school 3 days a week? And they don't get paid enough to, they're living at poverty level as it is. So how are they going to afford to pay for care?
Yeah, I'm seeing Meg plugging into the chat, we need to find ways to provide other options. What about that idea? And we heard somebody mentioning earlier, like, maybe there's some collaborations that could help support, these times where kids aren't in school and they're off days or whatever, these different models. Are there thoughts around things that could be done there? it sounds like Ruby's doing some work in Putney to kind of pair folks up in the community that may need care with those willing to provide it. Maybe there are other structures like that emerging in the region now.
I also just want to add one other thing that I didn't mention before. Partly I didn't mention it because I don't really have my finger on the pulse of it, but many of our local schools have a Four Winds program or had volunteer programs in the school that will not be running. And those were volunteer programs where community members would come in to do nature education or some amount of educational enrichment for the kids. And I think that getting an understanding of what those programs were and how could they continue to run outside of the school district, because it's been made very clear that that's not going to happen inside the schools. So that would be something to consider and think about. And I don't quite know how to start that beyond, like, I know the person who runs Four Winds for here in Putney, but maybe talking to the school district and asking them for references and to introduce us to those folks. Yeah,
thanks, Ruby. Your comment sparked for me, I am just scrolled up to the beginning of the chat, and Stephen Dotson, he's the Brattleboro Sustainability Coordinator, and he had to jump off, but he was sharing kind of a parallel idea around supporting outdoor classroom and outdoor learning, and how can we use our outdoor spaces and help. And so he did put his email there if folks are interested in that discussion, and we'll share the chat in the follow-up as well. And I will just take a second to say, and I know Dana, you're waiting, I'm going to go to you next, but just a second to say that we will be following up on this forum with a survey link. And so we're going to share these chat notes, we're going to share the notes, but also if there are other ideas to share, we're going to follow up in that way. And also, if you know of others in the field or that might have ideas, please feel free to share that. Feel free to share that survey with them. Dana, you said no, you're not.
Chloe, thank you for the $15 an hour, and we need to be able to offer health care, for our families. We are really ready to develop perhaps another bureaucracy, as we did with public education, because times have changed. And I think this is where we really must advocate. I'm going to say something that might be contentious, but I'm going to say it because I have talked with some of our legislators who are a little bit older, a little bit more like me. And, why can't your kids go to the next door neighbor or the grandmother? Well, those times have changed, and we need to develop those policies, particularly if we're going to go forward and develop a really wonderful workforce development for our state.
Yeah.
That's it.
Thanks so much.
I'm
done. Janice, your hand is up.
Hi, I work for the Windham Southeast Supervisory Union. I think I might be the only school person in this group, and I have to say that it's sad to hear that there has been so little communication and collaboration between the schools and the community groups that could be helpful to families in this time. But I will say that every bit of thinking power and energy and time has been going into schools just trying to figure out and wrap their heads around how they're going to open and how they're going to keep teachers safe and kids safe and transport kids. It's an unprecedented time and very big problem to solve. But I would just say that if any people here are parents in schools, each school has a leadership council. And I've been trying to think, as I'm listening to this conversation, about where are the places that parents and community members could bring these issues to school administrators, where they are really supposed to be listening to parents as leaders in their schools. And I would just encourage anybody here who's a parent, get on a leadership council, make sure your voice is heard, and bring up some of these really good ideas and thoughts for collaboration.
Thanks, Janice. I appreciate getting some perspective from the schools and some thoughts on where folks might be able to plug in, because I think you're right that did seem to be a gap in kind of finding that collaboration and partnership, but not because the schools aren't busy trying to figure out what they're going to do. Sue, Fortier.
So just real quickly, one of the advantages of being connected to a national organization is that we get to learn from what everyone else is doing. And in the New England region, we are working really closely with Wise that have been doing this. Like they've been doing essential childcare. They've been helping with remote learning, and about to go on a call next week around what does that look like, what worked, what didn't work. And I know that we have that happening in our region too, including us ourselves. We're doing it. We have a lot to offer in terms of what's working and what doesn't work. We've got 60 kids a day wearing masks all the time without any issues. So let's learn from each other and figure out those things that aren't working so that we can be better at it as we move forward in this.
Yeah,
including the schools. Schools need to reach out to us because we are the ones who've been dealing with these kids all, since schools closed. So they don't need to be doing this in their, in isolation.
Yeah, thanks. There's a real learning opportunity there. And I just want to mention in the chat, there's some good conversation going on around the potential for outdoor programming, but the common question here is who will pay for that programming? That's certainly a question we're hearing frequently in this conversation, unsurprisingly. Margot, go ahead.
All right, I'm going to take off my scribe hat for a minute.
That's fine. Go ahead.
Because I just want to sort of, I guess I'm representing also from the school perspective, the public schools. I sit on a school board in our communities, and I think there's many challenges. I think schools need to be a part of the conversations. They need to be looking at the full scope of, our childcare issues from infant on up and be a part of the solutions and strategies. But I think schools are also really underfunded and are being, they're in the same boat of more mandates are being put on them, when their whole early childhood education, and we needed to start having pre-K and putting funding into pre-K. There wasn't funding going into the school budgets to support that. And so all of a sudden we're adding all these grades for the pre-K and the funding there. And I think it's a systemic problem, whether it's the bigger funded public schools or whether it's the whole issue of our very critical early childhood or the aftercare. It's a continuum, and there needs to be funding, I think, going into each of those sectors to really support the systems that are there or need to be developed to make that, because I think we can't expect that public schools can continue to take on, they're not just teaching our children these days. They are looking at a whole child and doing so many more issues than they ever had to in the past. It's way beyond just teaching. And they can't be the only ones there. So they need to reach out, but there needs to be funding and support and community conversations across the spectrum. So it's a very complicated issue.
Yeah, it is complicated. And I think that point you're making, Margot, that this was something that came up in Orange County on Tuesday as well, that idea that schools are not just educating, they're providing all kinds of services. And this interesting conversation emerged in Orange County where there was a health the head of a healthcare center in Bradford, who said, we've got funding, and I don't know where their funding came from, and if anyone's interested in finding out, I can find out, but they said they have funding to actually place mental and behavioral health and medical health specialists with schools and childcare providers to support them in this. And everyone was kind of chiming in to think about how could that, how could they use that? And it just gets to what you're saying, Margot, that it's going to take partners, and maybe it's not just childcare providers in schools, it's other community partners that can help support in this really challenging time. Thanks. Any last ideas before we turn to our visiting team to share some reflections? Well, I want to thank all of you for the thoughtful conversation, and my biggest takeaway is there's so much collaboration and coordination already going on at all kinds of different levels in your region, and to hear, you have these hyper-local initiatives in Putney and Rockingham and others, but then these regional groups coming together. It's powerful to hear, but I'm hearing you all loud and clear but in order to make a lot of those effective and successful, that there's a real funding gap there, and I hear that. And so why don't we hear some reflections really quick? Sheila, maybe we'll start with you first, and then we'll go to Trey, and Margot, if you'd like, I'll come to you last if you want to share some reflections as well. Sheila, what were you hearing?
Hi, everybody. You can hear me, right?
Yeah, we can. Sound good.
Okay, great. As I work for Senator Sanders, I'm an outreach representative for him, and early childhood is in my portfolio. I actually know some of your names, etc., because for 20 years before I worked for the Senator, I've only worked for him for 3.5 years, and I'm actually close to retirement. I worked for Voices for Vermont's Children, and I worked in the policy and advocacy around early childhood. So this is a fascinating conversation for me to hear. It's so good to be hearing from Vermonters again. I mean, that's what I was doing for the Senator. That's why I wanted the job. And now I've been in my house just like everybody else since March. And actually not even hearing from as many Vermonters as I'd like to. You tend to get into these meetings where it's mostly like upper level, maybe some providers, but upper level officials, that sort of thing. So it's really good to be hearing from Vermonters, and I really appreciate it. I think what hit me tonight so strongly was, first of all, yes, just like Jenna, the collaboration, the rich collaboration in your community is just inspiring. And I've known that about the Windham area forever. The thing that's hard for me is that how did we get here where we still have a terrible shortage of childcare slots in our communities and our state? Why are we here, and what do we have to do something about it? And I often talk to my contemporaries on the budget committee, which my senator is the vice chair of the budget committee in Washington, D.C. in the Senate. And we always just go back to the mantra here tonight, which is money. We have to get money into this system. We have to infuse it. We have to. And we have to, I watched for years. I remember giving a speech on the state Capitol steps, lamenting how the child care budget was balanced on the backs of child care providers. And it's just an absolute crime that this has happened, and it hasn't changed that much. I'm so sad to say. I think I gave that speech in like 1999. And we know, I'm sure you probably know, my Senator Sanders, believes in universal child care. He would like to see it funded, fully funded, and he would like to see parents able to stop struggling to afford to work and pay for childcare. It shouldn't be that way, but it is right now. So I just saw so much from you. I love I have pages of notes, which I'm going to, and every time I see Bernie, he says, okay, what's going on in childcare? What's going on in childcare? He really cares. He does. And I always give him an update, and I'm going to be typing all these up. And the next time I see him, he's going to be hearing some stuff from Windham County. I think just, let's see, the fact that you have all talked about the continued need for available, safe, and affordable care all through your area. And I do remember meeting with the collaborative in Guilford maybe 2 or 3 years ago. And that organization is just doing so much, but we have got to get funding. And the federal government has got to come forward on this, yes, as everybody knows. Yes. And we do know that, there's, as maybe it was Dana that said, I mean, they are coming forward a bit. They are finally figuring out that this system has got to be fully funded. It took this horrible crisis to show this, which is very sad. I really do. I could go on, and I won't do that because I know we don't have a lot more time and we need to hear from Trey. But if I'd really like, we should give my number and everything, Jenna, to people, and my email, because I'd really like to hear from you. And I put this stuff together. I put what you're telling me together, and I do talk to the senator about it, and I do talk to the rest of his staff. So stay in touch with me. And I guess that's it for now. Thank you.
Thank you, Sheila. I appreciate it. We will be sending everyone participating a full list of the visiting team and contact info, but it may take a little time to turn it around. So if you want to plug your email and phone into the chat box there, that could be a way for people to get it a little bit quicker if you're able to do
Great.
that.
I'll do that.
Okay, thank you. Trey, go ahead.
It was, what a treat. What an amazing group of folks who are really aligned in vision, the sense of the importance of what you're working on and what we're talking about tonight, and the sort of the essence and essential need of this. So it was, honestly, that was an hour and a half that passed like that, listening to you all think and share and talk, and a really, like I said at the outset, a real privilege to be able to be here on behalf of Let's Grow Kids. Having said that, I want to also say that I, was sort of blown away by how well you captured what's at stake, right? So starting with that, like, why is this an important conversation? Why are we talking about this as if it's a, at least under the Vermont Constitution, a constitutional right, which, by the way, I think it is. I think that the Brigham decision that led to Act 60 did establish that equal access to the school system for all of its benefits is a constitutional right in Vermont. So, I think what you all were saying is that we're talking about economic development and demographic growth in Vermont. Dana, you really hit on that really well throughout this. We're talking about increased wages for historically women-owned businesses in Vermont and in the Windham area. We're talking about healthcare outcomes. We're talking about outcomes within our K through 12 system. We're talking about outcomes in our criminal justice system. We're talking about a lot of positives that are there if we thrive. We also spent a lot of time talking about whether or not we'll survive, right? So we're lost in the maze, and we're going to not only get to the end and ring the bell of success, but have a wonderful experience and thrive along the way. Or we're lost in the maze, and we're just going to be lost in the maze. It's too expensive to do everything that we talked about. There's not enough money at the state level. Well, we couldn't impose a 1% sales tax because of the New Hampshire businesses, or we can't do this, or we can't do that. There are a lot of threats to this if we feel like we're only going to survive. Instead, we have to go back to, let's not just talk about surviving, let's talk about thriving. So I also want to say that you have in Windham County at the Senate level with Senators White and Ballant, and then you're the representatives to the Vermont House of Representatives, some amazing legislators, some really powerful people. They need to hear what you just shared tonight. That it needs to be affordable, it needs to be accessible, it needs to be high quality. Teachers need to be well paid. We need to make sure that there's support for new programming, for health-based programming, for outdoor-based programming, for programming that is going to draw people to the state. They need to know that this isn't like a kind of a wish list thing. This isn't a, like, if everything else was good, then let's work on this. This is up there. I heard somebody say, like, we need broadband and internet access to grow and thrive. Now we need really strong childcare. And if we can build on those foundations, and if we can establish a governance system that brings in the K through 12 partners, that brings in the healthcare partners, that brings in the folks who are doing this work in other sectors, at children's integrated services, in other community organizations, then we're going to have a lot of people around the table making sure that not only do we get those economic development benefits, but we don't let children slip through the cracks. I heard you talk about all those things tonight, and I felt really glad about that. So I want to say a couple more things. One is that there's a couple of like really, clear levers to pull, right? When we talk about more money in the system in Vermont, well, first of all, we should all call Sheila. We should call her tomorrow, we should call her next week, and we should call her the week after that, because we do need federal assistance. It would be great if our federal delegation worked with other states, other blue states, other red states, other states, and figured out how to do paid family medical leave, figured out how to drive more money into the Child Care Development Block Grant Program, more money into the Community Development Block Grant Program, more money into the Brownfield Program to clean up communities and make those spaces in the community out there. So we certainly want help at the federal level, but we also want to let people in Vermont know. We want to let Becca know. We want to let Jeanette know. We want Emily Kornheiser and Mike Morwicki and Kelly and Carolyn Partridge, all the fabulous people, that investments in the Child Care Financial Assistance Program could be made to expand eligibility and make it more affordable for families. We need to, the Scott administration promised we were going to be on a trajectory for that. We need to get back on that trajectory of increased eligibility. We also need to expand the reimbursement rate in the Child Care Financial Assistance Program. So again, these are things that if you want to organize around this at Windham, and if you want help with this, Let's Grow Kids certainly can help, but you all can do this yourselves too. You were right on these things. Increased reimbursement rates would drive more money to programs so that you could pay for higher teacher salaries and hourly salaries for staff, could pay for more professional development and training so that people could go up the career ladder, and could pay for some of that programming that we want to have at a time like this. We also might talk about pre-kindergarten and the 10-hour stipend that we currently have, but that could be expanded or augmented in some way so that more families could access a sort of reasonable dosage of pre-kindergarten for their 3 and 4-year-olds, so that they're ready for the K through 12 system, ready to thrive, ready to go on and be successful. So I think, there are obviously things you can do. I heard people talking about the need for actual spots right now, not just waiting for a 1% sales tax increase. And so, the VCRD and Let's Grow Kids, we've collaborated. There's a guide to how to build more childcare capacity in your community that we've worked on together. We have a grant program. There are state and federal grant programs that exist. People referenced them during the call. If you want more information on how to build spots right now, there's some capacity, there's some facility to do that. But if you want to create a system that's going to do the things that you talked about, the things that I was trying to highlight when I said what's at stake, it goes back to what everybody, sort of the theme. We need more money here, and we need our legislators to know that this is a top 3 issue with healthcare and broadband. And if they don't get this right, we're going to keep telling them, that they need to get it right. We're not in the business of telling you who to vote for, and we're certainly not advocating that. But we do want you to tell the people you vote for that this is important to you. This is a top 3 thing. Anyway, I obviously could go on and on and on and talk to you at length. Emily Wagner, I see, is on this, who's also a Let's Grow Kids colleague of mine and knows some of you down in the Windham area. We'd love to join together with you and your action teams and your community organizations, talk about how to talk to state officials, legislative officials, federal folks like Sheila. Sheila opened an invitation, but not every most of our offices are open, but we want to give them concrete things to work on. And we do need to keep telling the Scott administration that they've got to get back on their 5-year plan and expand it, by the way. Let's really invest into this system. Anyway, Jenna, I'm running over the time, but thank you so much.
That's perfect timing, Trey. I think it's a good way to end as well. We're at 8:10, so we do need to head back to the closing session. I just want to close by thanking you all. I think you're all heroes in the work that you're doing and providing critical care to families in Windham County and beyond. And so thank you for being on this call, but mostly for just doing the work you're doing every day. So appreciate it. I'm going to hit in the chat here. I'll put the link for the closing session. You can copy that, leave this meeting, paste that back into your browser, or just click the links from your email or the website again, and I'll see you back in the full session. Thanks, everyone.